接下来我做一个前导的一个介绍啊。那我们今天晚上的这个课程主题就是有关于这个 DAI program 的一个整体的一个 overview 啊。那我们是请那个 Dr. Carrie D'Ambrosio 来跟大家做这个教学。那Dr. Carrie 我们叫他 Carrie 好了，比较简单啊。这个 D'Ambrosio 应该是意大利的一个姓氏哈。那就直接叫我们老师叫 Dr. Carrie 哈。那 Carrie 老师他的这个体系呢，大家应该很熟悉哈。这个 Uplager Institute 就是有关于颅键系统。那另外一个 Barrow Institute 是有关于内脏的部分啊，内脏的手法啊。那老师的这个 DAI 的 program 呢，事实上跟另外两个体系呢并列啊，是在这个 International Alliance of Healthcare Educators 啊。所以在这个联盟里面呢，有这三大体系啊，所以它其实地位是跟 Uplager、Barrow 是一样的啊。对，那只是我们国内大家对于这个 Uplager 还有这个 Barrow 是比较熟悉的啊。那事实上，老师的这个整个体系呢，因为老师本身是刚刚讲过是一个 osteopathic physician，是一个骨病学的医生啊，所以呢，他的体系就是把这个整个 osteopath 一个很完整的东西，经过他，因为老师他的背景非常多元啊，他本身也是物理治疗师，那也是 DO。那他另外也有这个针灸师的执照哈。那曾经也在对这个也是这个 sports medicine 的一个专科医师哈。所以他的背景非常多元，所以他的这个 view 呢就会比较 comprehensive 啊。所以我们为什么会想要引进老师的这个体系呢？我个人想的话，以我个人来讲的话，主要是两个原因哈。第一个，那它是一个 holistic approach，那跟我们权衡学会的这个理念是非常吻合的啊。我们希望是一个 holistic approach，而不是一个头痛医头、脚痛医脚的系统。另外呢，它是一个 comprehensive 的一个 osteopath。那 osteopath 我们那个在国内呢比较完整的体系比较少见哈。我们很多医生啊、治疗师啊都还要飞到那个美国的 Michigan State University 去学啊。那现在就不需要飞那么远了啊。我们大概在国内就有这个很完整的 osteopath 的体系可以学习。好，那我先介绍一下我们老师哈，Dr. Carey。那 Carrie 他本身是一个 osteopath physician，他也本身也是 physical therapist and acupuncturist。那么他也是positional release 的那个书本的一个作者啊。那他有很多的文章也在物理治疗、职能治疗还有 massage therapy 的一些 journal published 啊。那老师从1988年就开始做这个讲学哈。那现在已经在全球20多个国家进行过教学。那他也是就是 Uplager Institute、Barrow Institute 的一些的这些资深的讲师啊。老师的体系里面应该有3个 curriculum 啊。第一个是 lymphatic 啊，第二个是 osteopathic 啊，第三个是 energy。那我们先介绍第一个 lymphatic curriculum 啊。那lymphatic curriculum 里面又有分 systematic，就是全身性的，还有这个 specific，就是 local 的，就是局部性的。那局部性的话，就包括这个 cranial cervical，还有上半身，还有下半身啊。那第二个 curriculum 是筋骨的这个学程啊，orthopedic 啊。它有包括全身性的 orthopedic balancing，那也有包括局部性的 specific。那 specific 里面有针对肌肉的部分啊，fascia 的部分。那 fascia 又分为上半身、下半身，还有 visceral 啊。另外还有 cranial 啊。那最后有关于这个关节的部分的一个 balancing。第三个 curriculum 就是 energy 的部分，因为老师他本身也有这个中医和针灸的训练，所以他发现这个能量对人体的 healing 来说的话是非常重要的啊。那这个部分的话，在跳脱到传统的 osteopath 之外所以它有包括全身性的 energy 的 balancing，还有局部性的 balancing。有 这些其他的这个小学程啊。所以以上这3个 curriculum 是目前老师最新的一个 program 的这个设计。那我们这一次在4月份，要做的这个呢是这个 systematic lymphatic balancing 啊，还有这个 orthopedic balancing。那这2个的话，应该算是入门课程啊，入门课程。好，好，那接下来我们就把时间给我们的这个 Carrie 老师。好，Hi Carrie，来，哎，I just finished my introduction, and now that's your show now.
Okay. All right. So thank you for the introduction. And I've been going to Asia probably, yeah, the last 20, probably 25 years. I've mainly been teaching in Hong Kong, Singapore, South Korea, Japan, also mainland China. Uh, where was I there? I was in Beijing, I was in Shanghai teaching. So I'm really looking forward to coming to Taiwan this spring. And I want to thank Dr. Wang for inviting me. And this is my way of sort of getting to know you guys and you guys getting to know me. I'm bringing a class and it's called Systemic Manual Therapy. And there's going to be 2 components. Like Julian said, there's the orthopedic and lymphatic, and you really need both. And hopefully in this presentation that I'm going to give you, you're going to understand. I want this to be sort of educational for you. I want you to get something out of this. Think about this. I've taught all over the world. I've taught throughout Asia, throughout Europe, Canada, USA, South America. And, you know, I talk to therapists all the time. I talk to physicians, practitioners. Let's say, you know, 2 patients were to come into your office, and these patients each have knee pain. There are 3 questions that we all ask as clinicians. The first question we ask is, where do I treat? So ask yourself that question. Patient comes into your office, they have knee pain. Where are you going to treat? And it depends how much time you have. If you only have 10 minutes, 15 minutes, well, you're probably just going to treat that knee. Some patients may be with you a half an hour. Some people have the luxury, you know, of a 15-minute treatment. So it all depends on time constraints. But how do you know where to treat? Are you going to treat that knee? And are you going to treat somewhere else, and why? The other question we ask, once we decide where it is we're going to treat, the second question we ask ourselves is, well, what am I going to treat? Right? And there's lots of things to treat. Okay, am I going to treat the muscles? Am I going to treat the fascia? Am I going to treat the joints? Am I going to treat, you know, the lymphatic system around there, the energy? Like, how do you know what it is you're going to treat? Is it based on the last course you took? Right? Or do you have an idea? And then finally, once you've kind of figured out what you need to do you have the tools necessary to do that? Okay. And Julie, I was going to ask you if we're taping this. I didn't think I heard that. So this is what my talk is going to be about, the systemic manual therapy, and also how you make these clinical decisions. My goals of this presentation is to answer those 3 questions for you, but also for you to have some new strategies. My goal is, after this, you know, hour and a half we're together, I want to improve your clinical decision-making skills. I want to, you know, help you create maybe a new treatment approach. Maybe, you know, you've been working more locally, you know, with patients. They come in with a shoulder problem or neck problem, you tend to work locally. Well, I'm going to introduce something different, you know, a systemic approach. And also my goal is, we're not trying to replace anything you're doing. We're trying to add to it. We're trying to make you better. So this approach that we're going to give you is going to blend in beautifully with what you're doing already. Okay. And the goal is to get better outcomes. So what I did when I was thinking about this hour presentation, I was thinking, okay, what's the best way to convey this information, but also for you guys to get something out of this? So I put this together. So first of all, you might not have heard of what systemic manual therapy is. It's like Julian said, it's a holistic approach. It's a total body approach. It's systemic. Okay? We are going to focus more on the interconnection of different systems. We're focused on the pathway of healing. No, not so much on local symptoms, even though we get rid of those. Our focus is something totally different. So when we look at this, our focus is going to be, you'll see this as we go through, is evaluating and treating these lines of tension, right? In the legs, the arms, your torso, the head and neck. So what are these lines of tension? They can be fascia, they can be muscles, they can be joints. We also want to balance the transverse diaphragms, your pelvic floor, your respiratory diaphragm, your thoracic inlet. Okay, why do we want to do that? We'll talk about that. We also want to optimize these pressures. So the area of greatest negativity in the body is your chest, right? And your head has a higher pressure. Your abdomen has a higher pressure. Your pelvis has a higher pressure than your abdomen. So why do we have these? Because everything in your body moves from a high to a low pressure. Everything has to flow back to the heart. Venous return, right? Lymphatic return, it's got to go back there. So what's the number one killer out there? It's heart disease. Why? Most patients, I'd say 80% of the patients that come into my office are restricted in this respiratory diaphragm, thoracic inlet, and also these ribs. They're also under a lot of stress. There's a lot of tension in this area. So this is an important area to keep mobile. Things that we want to do with this systemic approach is we want to improve circulation. Why? Because circulation is the river of life, right? It brings oxygen and nutrition, but also takes away the metabolic waste. We want to improve nerve supply, okay? So the brain, how it communicates with the environment and how we're able to go from the central to the peripheral nervous system. This is important. And also energy flow. I'm a doctor of Oriental medicine as well. And it's important that we discuss energy flow. These are all vital structures. These are all things that are necessary for your body to heal. And also the autonomic nervous system. Right, we're going to talk a little bit about that and why that's so important, because that controls this vasomotion, right, of the blood vessels. So if you're on sympathetic overload, you're not going to heal very well. We're going to talk about that, okay? So through these, this approach, these interventions, our goal is to create a better environment for healing. That's the role of manual therapy. And this systemic approach does it to a greater degree. Our goal is to improve wellness, but also restore balance to your body, because we believe that we're treating an intelligent body, that your body knows how to heal itself, right? All we have to do is do enough, and nature does the rest, okay? So why learn this approach? Let me give you an example. These are two patients of mine. So two patients are both coming in with neck pain. So where do you think they want me to treat? The neck, right? Their insurance company wants me to treat their neck. Their doctor wants me to treat their neck. They want to treat their neck because that's where they feel their symptoms. But we got to ask those same questions, don't we? Where to treat, what to treat, how to treat. Okay. When we look at this guy, he's actually an accountant. He's tall. He's like 6'6". And I remember going to his office. He has his computers were too low, so he's all hunched over, and it was during tax season. So his evaluation was very specific. It was the levator scapula muscle. So we had to release that. We had to work on some of the joints, of the cervical spine, C5, C6. But his was very straightforward. It was in that area. So we did a little muscle work, a little joint work. We did ergonomics, right? We sort of fixed where his computer height was, gave him some clues, gave him some exercises. But she was a different story. She had neck pain, but she had it for 10 years. And it was interesting that when I did I'm going to talk about the evaluation I'm going to teach you. When I did the evaluation, she had a lot of tension in her legs, especially the left leg. I remember all the things I talked about in the systemic approach. Her diaphragms were affected. The lines of tension were affected in her legs, arms, head and neck. Her sympathetic system was on overload. So it was affecting all her vital structures. So it was interesting. She had this problem for 10 years. And I said, what happened 10 years ago? She was in a car accident. And she badly injured her left foot. And she had scar tissue. And you have to understand that the fascial system is one continuous system. It's like a big jumpsuit. So picture this. She's lying on my table with her legs straight in front of her. Everything's flat. And I'm at the head of the table. I'm picking up her head and I'm trying to move it in different positions. It doesn't move very well. But then I ask her, I want you to bend your left knee. What does that do? Well, it takes away tension in the fascial system on that side. That's the side where she injured her left foot. But it was creating a fascial pull. As soon as I did that, I could move that head in a lot of different places. She was amazed. And she goes to me, oh my God. And then, so she was a systemic approach patient. And I had to release these lines of tension in her legs, her arms, her head and neck, open up her transverse diaphragms, balance her autonomic nervous system. She did phenomenal. Within 2 days, that pain was gone. She's still a patient of mine. She comes in every once in a while for a tune-up. Okay? So this is important for you to look at. This is what I want you to be aware of. You have 2 patients. They both have neck issues, but they're very different. And it's up to you as a practitioner to know the difference, right? Don't assume that when somebody comes in with a knee problem or a neck problem that you just treat that area. You gotta ask better questions. Okay, we gotta ask better questions. Now, so why learn it? It's for those patients that fall through the crack, and we all have them. We have those patients that go from doctor to doctor, therapist to therapist. They're over-medicated. Their surgeries didn't work. We owe it to those people to give them a better approach. And I'm not saying one approach is better than the other. I'm saying we need to evaluate. You let your evaluation determine what approach you do, right? So how did I develop this program? So that's me right there. That's me in my 20s. I was number 35. I played American football. And I wanted to be a professional football player. We just had our Super Bowl, last weekend. So I love football, but I got injured a lot. I got injuries to, I had concussions, neck problems, shoulder problems, knee problems, all sorts of different things. So what would they do with me? They would do specific work. If I came in with an ankle problem or a knee problem or shoulder problem, that's exactly where they would treat me. And what would they do? They would put ice on me. They would put electrical stim on me. They would do ultrasound. They might massage me. They might stretch me. These treatments did help to a certain extent. Okay, they got rid of the inflammation, and they worked on a bit. But every time I went on the field and I tried to play, I tried to run, I tried to do different things, I kept complaining, there's something wrong here. There's something tight here. Because it was fascial restriction. There was joints they weren't looking at. They were just putting out fires. They weren't looking at my body as a whole out of all these things I accumulated in 13 years of playing football. So my dream of playing professional football kind of fell by the side. So I had to do something else. So what did I do? I became an athletic therapist, first of all. And what kind of treatments did I do? I did the same thing they did to me. I did the cold therapy, ultrasound, electrical stim, stretching, massage, all those things. But I knew there was more. So then I went to physical therapy school. I'm from Canada originally. So I went to University of Toronto. And there I met one of my first mentors, Doug Freer. And he started to introduce to me osteopathy. And I started to take courses. I took hundreds of courses. I studied fascial courses. I studied craniosacral courses. I studied visceral manipulation courses, muscle courses, joint courses, lymphatic courses. And you know as well as I do, when you take a course, you do trades, with other therapists. So you get your body worked on. I can't say that it was one technique that got me better, okay? But it was an accumulation of all these approaches. Every time I learned something new and had my body worked on, I was feeling better. But eventually, I thought about it going back playing football, but I thought, I really want to do this. I had this burning desire inside me to really learn, like many of you, but also find a better way. And I remember my first clinic, a patient came in and they had low back pain. I didn't know what to do. I evaluated them, but I had so many techniques. Remember, I was taking all sorts of courses. Do I do visceral manipulation? Do I do craniosacral? Do I do muscle energy, joint mobilization? I mean, it goes on and on. And I go, this is crazy because in a lot of these courses, they never really taught you how to evaluate. They just taught you treatment. I had lots of treatment, right? And all therapies work. But what does that patient need in front of you? So I went back to osteopathic school. I went to two schools. I went to one in Canada and one into England. And this guy here in the middle, this guy here, this is John Wernham. He was one of my teachers. When I met him, he was 99 years old. And he was still treating 8 patients a day at that age. He died in his 100th year. And I studied with him at his College of Classical Osteopathy. And it was because of him that I really learned the total body approach, the systemic approach. And I combine that with all the specific approaches that I learned. And I love osteopathy because osteopathy is not about learning techniques. It's about learning about the body, anatomy and physiology. It's about learning, it's making up your own techniques. Because A.T. Still, the founding father, he said, don't do it like me, invent your own, create it. Understand the concepts and principles, but create your own way. And I love that. I love that philosophy. I also became a doctor of Oriental medicine because, again, there were certain patients that weren't responding. There's other things going on. There's emotional issues, right? There's energetic issues. Like, for example, if I have a shoulder problem and my shoulder is forwards, you might think, well, the reason it's forwards is because you're all tight in the front. But what if you were weak in the back? See, if you're weak in your muscles in the back, you'd be brought forwards. So Chinese medicine got me to look at the yin and the yang, the two aspects of the body. Excess deficiency, specific, systemic. Look at the whole body. Sit back and look, everything is there in front of you. I love this quote. This is John Wooden, this guy on the left. He was a basketball coach in college in the US, at UCLA in California. The reason why I've got him up there is he won 11 national championships. And he won, I think it was 6 or 7 in a row. The closest person to him won 3. And they only won 2 in a row. This guy was amazing. And I love this quote by him. It's what you learn after you know everything that counts. I'm curious. I'm still curious. I still love to learn. And I'd never want to lose that. And I remember this quote all the time because you can get kind of stuck in your ways and say, well, I've done all these different things. I've done athletic therapy. I've done physical therapy. I've done osteopathy. I'm an acupuncturist. I've got enough. No, I'm still learning. I'm still learning different things. And I want you to have that same curiosity. I want you to be curious. Have I got all the answers? Think about some of your patients that maybe aren't responding. Okay. This is my clinic. I'm in Sarasota, Florida. Very proud of this place. I built it 22 years ago, and I'm here right now in that clinic. And I have three simple parts of my philosophy. DAI is my D'Ambrosio Institute. Everything is based on evaluation because I believe that all therapies work, all treatments work. So you need to evaluate. And this is going to tell you where to treat, what to treat. And then I'm going to have a treatment, right? That's going to back up that evaluation. And then we tell you, or we show you how to treat. And how do we know we're successful? We reevaluate. It's very simple. We reevaluate. I've done this. I've been practicing since 1988. I've treated over, I don't know, 30,000 patients. So I follow this over and over again. How can I become better? I love John Wern. I'm 99 years old. I want to get to that point, still treating 8 patients. So let's do a case study. Let's go back to these knee patients. So you have 2 patients coming into your office. They both have knee pain. And they want you to treat their knee. Their doctor does. Their insurance company does. Right? And we have, those same questions. Where am I going to treat? What am I going to treat? And do I have the tools to treat it? But I want you to ask a different question. I want you to ask, well, how do tissues heal? What does that knee need to heal? And this will kind of segue into this systemic approach. What does a knee need? Well, it needs blood supply. Where is it going to get it? Put your hand on your heart and just draw a line all the way down to your knee. There's a pathway. Pathway is a good word. So there's a pathway from the heart to your knee, down the descending aorta, common iliac, right? The external iliac, femoral artery, popliteal, genicular artery, etc. You know the pathway. And that carries oxygen and nutrition. So that knee needs that pathway. But in order for it to get the oxygen and nutrition, if there's been injury here, you got to get rid of what? Waste products. There's an old saying in osteopathy, drainage precedes supply. And what that means is in order for that knee to get blood flow, oxygen, nutrition, you got to get rid of the metabolic waste. And that is venous return and lymphatic return. You have to know it. It's important. That is important. And there is local circulation, which would be this picture on the left, right? And then there's the pathway, okay? And in everything, we need that blood supply to, within, and from. So circulation is extremely important. What else is important? Nerve supply, right? There's a flow from your brain in your central nervous system down and then into the peripheral nervous system, okay? Into the lumbosacral plexus, femoral nerve, all sorts of different nerves that are going to affect this. We also have the autonomic nervous system, okay? And the autonomic nervous system is going to affect circulation, okay? It's going to affect vasomotion. So if you look at this picture here on your right, you can see that these are blood vessels. These are the layers. There's endothelial cells, there's smooth muscle, and then there's connective tissue. This smooth muscle is under the control, right, of the sympathetic nervous system, okay? And so this supply is extremely important. And this is going to affect local circulation, right? And it's also going to affect more systemic circulation, okay? It's going to affect both, okay? What else does the body need to heal? Well, it needs energy supply. We also need energy supply, and that energy supply, like I said, is created by the food that you eat and the air that you breathe. It's in the chest. It flows to your hands. From your hands, it flows to your head. From the head, it flows down to the feet and then comes back to the chest. So again, the chest is important. Remember, we talked about blood flow has to come back to this area. So this chest has to be kept open. Everything has to flow to that area, okay? Now, we also need, and this is where we come in as manual therapists, we need tissue motion. We need tissue motion locally at the site, in this case, the knee, but we also need tissue motion along this pathway, okay, along this pathway. So the three important things, this is important for healing. We need tissue motion, right, locally at the site and also the pathway, but we also need inflow and outflow. Outflow is more important. Remember, drainage precedes supply. So these are the key things that we need, okay? So what are the barriers to this, right? The role of manual therapy is to identify these barriers and remove them. That's what we do. We do manual therapy. So again, let's apply that systemic specific concept. We have two patients here with knee problems. See, one is more specific. One has other things going on, more systemic, which we're going to take a look at the difference. So for tissue healing to occur, right, there must be unimpaired tissue motion, right, locally at the site of the lesion, right? So that is going to affect local circulation to, within, and from. Along with, we need this pathway of healing throughout the whole body, and that's this pathway. So we need to evaluate both of those. So what are our specific barriers? Think of that for a minute. If somebody comes in with a knee problem, and we're going to treat the knee, what can we treat? What are barriers that are going to affect blood flow, energy flow, nerve flow, right? Lymphatic drainage. Well, these are the different types of things. We have muscle tension, right? You can have protective muscle spasm around that knee. And I have a course we teach that's called muscle balancing. You can have fascial tension around the knee, right? And I have a course and I teach fascial balancing. You can have joint stiffness, joint hypomobility. And I have a course called joint, balancing, right? We can also have swelling around the knee, and that affects the movement of fluid. And I teach lymphatic balancing. And one you might not think about is energy balancing for energy lesions. So when you look at the human body and you feel yourself, you're pretty solid. But your body is made up of systems, right? Your musculoskeletal system, urinary system, digestive system, coronary system. These systems are made up of organs. Organs are made up of tissues. You have four types of tissues. You have muscle tissue, right? Cardiac, smooth, and skeletal. You have nervous tissue. You have connective tissue, epithelial tissue, which is like your skin. It's the lining of blood vessels and cavities. So we have tissues. If you look at these tissues under a microscope, they're made up of cells. Cells are made up of organelles, like your nucleus, mitochondria. All of that is made up of biomolecules, your fats, proteins, carbohydrates, vitamins, minerals. What are they made out of? Molecules. Molecules are made out of elements. And this is into your periodic table. So everything is made up of atoms, made up of a nucleus, made up of protons, neutrons, and electrons, right? All these different aspects. So your body is made up of over 100 trillion cells. Each cell has 100 trillion atoms. So for example, your body is made up of hydrogen, carbon, nitrogen. If you look at carbon, for example, it's made up of, it's got a nucleus and it's got an electron around it. It's made inside the nucleus are 6 protons and neutrons, right? And we have 6 electrons around that. If you were to give that a size, the 6 protons and neutrons, let's say like a pearl, and you put them in the center of a big football stadium, that would be the electron field. So it's 99.999% empty space. So your body is made up of 100 trillion cells. Each cell has 100 trillion atoms. Each atom is 99.999% empty space. Your body is made up of energy, okay? So we also have a systemic barrier that's creating this knee problem, right? we have lines of fascial tension. Okay. So if you look at this picture here, here's a picture of fascia, right? Here's a picture of muscle, but there's more fascia in here. But look at the arteries, veins, and lymphatics all around it. So if you had fascial restriction or protective muscle spasm, this is going to create lines of tension. It's going to affect circulation. And it could be anywhere in the body. It could be in your legs, your arms, your head and neck, could be in your torso. Okay. And you can see how this can affect flow. It can affect flow to, within, and from. Okay. And we also have this intercavity congestion. I talked about how that thoracic cavity has to be the area of greatest negativity. Everything has to flow from a high to a low pressure. It has to flow back here. And heart disease, like I said, is the #1 killer. So a lot of times people are stuck in this respiratory diaphragm. They're stuck in these ribs. These are areas that we need to open up, right? So it shows what creates these cavities, your transverse diaphragms. So they go hand in hand. And if you're all restricted here, if you have all this tightness here, you're not going to get good flow back to the heart. Okay? These transverse diaphragms are also important. If I only had one thing to treat, it would be transverse diaphragms because of everything that flows through them. Okay? Your blood flows through them, your energy flows through them, your nerves flow through them. Okay, so everything has to move through these diaphragms. Okay, we also have the autonomic nervous system. We have the sympathetic system, T1 to L2. We have the parasympathetic up here, the vagus nerve, right? Cranial nerve 10. And we have down at the sacrum, S2, 3, and 4. So why is this so important? Well, because of vasomotion, because it affects blood vessels. It affects the smooth muscle, right, of the blood vessel, specifically the sympathetic. So if you're on sympathetic overload, you're going to have vasoconstriction, right? And so you're not going to get good blood flow. You could do all the massage, the myofascial work, the joint work you want to do, but if you don't change their autonomic tone, you're not getting good circulation. So it has to be part of your treatment. That's a systemic treatment. So you can see that this autonomic nervous system affects flow, right? It affects inflow and outflow. And then finally, these energetic stress patterns. You may see this with your patients. I mean, you could be the best manual therapist in the world, but you're not going to be able to help everyone. Sometimes when that patient is coming to you, they have headaches, neck pain, there's a story behind it. There's thoughts, there's beliefs, there's emotions, there's consciousness. There are things around us. ENV means environment that can affect. I remember one lady, she kept coming with a neck problem, and I would treat her and she would go away without a neck problem, but kept coming back with it. What happened was she moved from one office to another, and the air conditioning duct was coming on her neck. So she reacted to the cold. Somebody else could be going through a divorce who had a death in the family. So there's an emotional area. You can't separate these things. Mind, body, spirit. It all comes together. That's that systemic approach. Okay. So now that you know a little bit more, you know what systemic manual therapy is. You know why you should know it. I mean, it completes, your treatment. If you know a lot of specific treatments, this is a different approach that complements the other program. I talked about how I developed this. I was a patient, right? I went through it myself, and I learned all these different things. And then we talked about, well, how does the tissue heal? What are the barriers? Now, as a practitioner, these are questions I had, as a therapist. So what do I do with all this information? Okay, that's we got to put it together for you, right? So we want to talk about those first two questions, where to treat and what to treat. So where do I treat? Do I treat the knee specifically, right? Do I do a specific approach? Is it all local there? Okay. Or do I need to treat the pathway? More of a systemic approach. Okay. So how do we decide that? Well, TBSE evaluation is the total body screening exam. That's what I'll be teaching you when I come there in the spring. So it's easy. This whole evaluation can be done in like 3 to 5 minutes. It's very quick. Okay. First thing is posture. So remember, when you do things, you have to have a purpose. Why am I doing this? Is I'm going to look at the occiput. Why am I going to look at that? Because the vagus nerve comes right out the jugular foramina, which is between the occiput and the temporal bone. Structure affects function. So I want to quickly look at that. That's going to tell me about the parasympathetic system. I can check the sacrum because S234 is parasympathetic for the lower 10%. Vagus nerve affects 90% of the organs. Rest and digest. So by looking at the occiput, looking at the sacrum, I have a quick glimpse of your parasympathetic system. Okay? Structure affects function. I also want to look at your sympathetic system. You have a sympathetic chain, right? Down each side. It's right where the rib meets the transverse process. And I can run my thumbs down. And if I see any asymmetry, right, structure affects function. Okay. So T1 to T5, this is where the sympathetic nerves exist that affect your head and neck, that affect your arms, that affect all the organs in your thoracic region. So it's very quick. T5 to T11, this is all your abdominal viscera and the body wall in that area. T11 to L2, this is your lower limbs, your external genitalia, and your pelvic viscera. So what does this mean? You could have a organ dysfunction and you could have a joint problem, right, in that area. And every time you try to treat the joint, it doesn't go away because you didn't correct the visceral problem. So you need to take a look. Is there a sympathetic component? Then I'm going to look at your shoulders. I call that the upper T lines. And remember, I've done this on thousands and thousands of patients. If I see that your shoulders are off, that's a quick assessment for me. That basically tells me you may have lines of tension coming in to this area, creating this imbalance from your head and neck or your arms. And if I look at the pelvis, the lower T line, if it's imbalanced, that usually tells me you could have lines of tension coming in from the legs. Okay. So the whole purpose behind this evaluation I'm going through is not to diagnose, but to decide whether I need to take a systemic approach or a specific approach. So if you look here, occiput's off, upper T line's off, sympathetic is off, and you can see that the lower T line's off, sacrum's off. So this is more systemic, right? It's starting to look systemic. So now I want to look at the lower extremities. What do I want to do here? Well, I want to feel the weight of each leg. That gives me an idea of congestion, flow. I want to evaluate range of motion. We call that a leg vector. And what am I assessing for? Lines of fascia and muscle tension and joint tension. You know, are they the same on both sides? And the more you do this, right, the smarter your hands get and you're able to feel it. I also can put the foot in my belly and compress and distract. So I'm feeling for congestion and distraction. So I can see, are there problems in your legs? I'm like a lawyer. I'm building a case. I'm trying to decide, are you specific or are you systemic? I can look at the upper extremities. I can feel the weight of your arm. I can evaluate the range of motion of your arm. I can do an arm pump. Same thing, looking for congestion, and I can distract it, looking for tension. I can also look at the head and neck. I can feel the weight of the head, and I can rotate it left and right. And what I'm assessing for is the weight of the head, congestion. I'm evaluating, assessing for lines of tension. Okay. And then the thorax. I need to take a look in this area. So I have a upper thoracic rotation, which evaluates that thoracic inlet, a sternal pump, and a lower thoracic rotation, which is evaluating the respiratory diaphragm. So why do I want to do that? Because remember I said before, everything flows back to the chest. It all flows back to this area. Okay. And so the heart, or where the sternum is, where the heart is. I want to say, is this area all locked up? Because there's something called Boyle's law. And Boyle's law says if you increase the volume of something, the pressure decreases. So if you come in here and everything's all locked and you ask them to breathe in and nothing's moving, then you got a lot of pressure there. You're not getting good movement. And then the last area I check is the abdominal area. I want to check the pelvic diaphragm. I'm going to rotate that. I want to check the abdomen. Why do I want to check the abdomen? Because that's where flow comes back to the heart, right? Your lymphatic flow, your venous return, and also arterial flow coming down in that area, okay? So when we ask the question, where do I treat? I do a total body screening examination. Here's an example for this patient. So what do we see? Well, pelvis is off. I see the sacrum's out. And there's fascial tension in that right leg. I would expect to see that with someone with a right leg. Most of their transverse diaphragms are fine. I don't see a lot of sympathetic, because the sympathetic problem, which is in T1 to L2, I don't see any problems there, and that creates vasoconstriction. I don't see any problem that would affect the pathway of healing from the heart to the knee and from the knee back to the heart. I don't see anything that would affect energy flow, throughout the body. I don't see anything that's going to affect nerve flow. What I do see is local stuff. I see the pelvis is off because of muscles, probably from that right leg pulling into the pelvis. And maybe that sacrum is off because of muscle imbalances and fascial imbalances, not so much the parasympathetic. So I want you to see from this finding and the evaluation of this person, this is a specific approach. And I would treat the knee. That's where I would treat. That's how I would decide. Okay. Now let's take a look at this guy. He's coming in with a knee problem. But look at his findings. All the transverse diaphragms are affected. Parasympathetic systems affected. Sympathetic systems affected. He's got lines of tension in his right leg and right arm. Right? So this guy's very easy to see. He's a systemic approach. So how valuable is this? Within 5 minutes, you can decide whether you're going to treat somebody systemically or specifically. How valuable is that? Okay. You're going to know right away within 5 minutes, 3 to 5 minutes. If you didn't treat this person systemically, those are those patients that don't respond. Remember the lady with the neck pain for 10 years? Okay. She had that problem. That's why you want to learn this. Now you understand, okay, I'm going to treat this person at the knee. So what do I do next? Well, you need to learn a specific evaluation, right? So how do you know you're going to treat muscle balancing? How do you know you're going to treat fascial balancing or joint or lymphatic or energy? We're going to talk about that. There are evaluations for that, very quick evaluations. Muscle balancing is usually a tender point in the muscle. Fascial balancing is a fascial glide. Joint balancing, you evaluate the integrity of the joint. Lymphatic, you can feel the lymph node. You can feel the local tension. Energetic balancing, we have a biofeedback test. So there are ways of doing it. That's what my institute's all about, is teaching you better evaluations to help you make better decisions for your patients. And we're going to show you, how to do these things, how to treat. But the key thing is the evaluation and deciphering it. Now with this guy, the total body screening examination, like here's an example here. So it's systemic, right? But look what's going on here. All the diaphragms are affected. Parasympathetic and sympathetic's affected. His right arm, right leg. But there's a difference here. The right leg is heavier. Remember when we evaluated the legs in the total body screen? Well, the right leg and right arm are heavier. And when I try to compress them, they don't move. When I feel the abdomen, when I do a compression in the abdomen or the chest, it feels full, it feels tight. This is telling me I have more of a systemic approach, but it's more lymphatic congestion. That's why I said to Julian, you need both classes. And you just take both together, and then you have everything you need on systemic. And then you just add it with what you're doing already. Well, let's say the person came in and they had all the diaphragms were affected. Your parasympathetic was affected. Your sympathetic was affected. There was tension in the arms and leg, but there wasn't any congestion. It was just more orthopedic. It was more lines of tension. There wasn't a lot of congestion in the abdomen or the chest. So there's a difference I want you to see. One, they're both systemic, but one's more congested, one's more specific. So what's our program? We're going to teach you clinical decision-making tools. Where do I treat? You're going to learn a total body screen. Okay. Are you going to treat the pathway? Right? Systemic approach. And then what do I treat? Are you going to treat more of a systemic, lymphatic approach? Okay. Or more of a orthopedic approach. So we're going to help you in this specific course decide what to do. Okay. Then the final thing is, how do I treat? We're going to teach you that as well. So when you look at this, if this person were to come in with that knee problem and you were to treat their knee, you would have terrible results because the pathway is not intact. If you try to treat them with a systemic orthopedic approach, you would have terrible results because they're different approaches. If someone has all this congestion, remember I said everything has to flow from a high to a low pressure? Well, there's a high pressure in your chest and your abdomen. You got to clear all that out. There's the circulation from your extremities can't make its way back to the heart, and the heart back there, it is all slowed down. So what do we need to do in this approach? We need to open up all the transverse diaphragms. All right? We need to balance the autonomic nervous system. We need to release lines of tension in the arms, the legs, the head and neck, but we do it in a certain sequence. And then we show you a total body, a systemic lymphatic treatment, starting at the heart and working our way, throughout the body. Okay, it's done in a specific order. So this is systemic lymphatic balancing. You want to be prepared for that. If I'm going to be there for the 6 days, you may as well learn both because, you're treating orthopedic, right? But then if someone comes in and they have more of a systemic body, you go, oh, should have taken that. I want you to know both. So you're prepared. I'm going to show you everything and you'll be prepared for this. Okay. And then we have systemic orthopedic balancing. Think of this as like a skyscraper, right? So a patient comes in with a neck problem or a shoulder problem. We need to build the foundation. So in the orthopedic approach, we start in the legs and we work our way up. Release the legs, release the pelvis, the torso, the arms, the shoulder, the neck. We release everything all the way up. And we do it in a supine, prone, side lying, and sitting position. Okay? So very organized approach. This is my contact information. You can take a picture of that if you want. And I think if you have a copy of you should have a copy of my PowerPoint slides, so you have that. So if you have any questions, on my Facebook page, we have something called Ask Dr. Carey. So if you have any questions, you can go there. You have my email address. I'm in Sarasota, Florida. And good. I'll hand it back to you, Julian.
Thank you so much, Gary.
You're welcome.
And yeah，那好，那接下来就是我们的Q&A 时间哈。那么我看看有没有什么问题要问 Gary 的。聊天室。
The one question people always have is how long does the evaluation take and how long does the treatment take? Evaluation only takes like 5 minutes. The treatment can be like 15 to 20 minutes because it's more of a systemic approach. And typically when a patient comes in, I would say 75% of my patients are systemic. Okay, they're systemic. And a lot of times I am treating a systemic approach first. And it may take, I had one guy, he was in the Army, and he came to me with a neck problem, a shoulder problem, and a knee problem. And he wanted me to treat all those different areas. But he's been treated before and it didn't respond well. So I said, well, let me evaluate you. And I evaluated him. He was a systemic approach. And I started treating him. But he was in the special forces. He had lots of trauma. That's why you have to ask questions. Have you ever had any car accidents, surgeries, falls? You look at all those aspects. And so he had lots of trauma. So I started to treat with the systemic orthopedic approach. We used to call that total body balancing, but we've changed the name. And the first visit, he didn't feel any different. He comes in the second time and we did it again, didn't feel any different. It wasn't until the third, fourth visit that things started to clear up, because think of it like an onion. You're peeling away layers of the onion, okay? Different layers. I had one guy who was a baseball player. He was a pitcher and he had hurt his shoulder. And he came to see me because he went to another clinic, and it was in the summer, and he was going to camp, baseball camp, at the end of summer. And the clinics that he went to were doing specific work. You know, they massaged, they did joint work, they did ultrasound, laser, you know, things like that. Well, that's not what he needed. When he came in, I evaluated him, he was systemic. And I treated everything in his body except his right shoulder.
Mm.
And then we came back to it, that right shoulder was moving much better. And then I
Mm.
treated it at the end. I wanted to show him the influence of everything. You know, we show you that. And he's still a patient of mine to this day. Whenever he's in town, he comes in. But you're going to love this systemic approach because, well, I haven't taught it in Taiwan. I've taught it in Japan and Hong Kong, in Singapore. I've taught it in South Korea, but not Taiwan. So you guys will be the first to do it. And you're going to walk away knowing this approach. So think of those patients that you have that may not be responding. They could be a systemic approach.
Oh, thank you, Kerry.
Mm-hmm.
Okay, here I have a question here.
Okay.
Mm. Okay, the first student asked a question about um, the assessment of the sympathetic system.
Mm-hmm.
We will evaluate the spine first, the T1 through all the way through L2.
Yeah.
But from the anatomy, the segments of the spine not necessarily corresponds to the segment of the spinal cord. So is this a accurate method to assess the sympathetic tone? That's the
Yeah, but
first.
you have to remember what we're doing. This is accurate enough for what we want to do. What's our goal? In this evaluation, I have one thing I'm trying to decide, or two things. Is this a systemic approach or a specific approach? That's all I'm trying to do. So we don't get into detail. There's other things I can do to be very specific on the spine.
Oh,
We
okay.
teach you those in my specific classes. This is systemic. We are teaching you a total body screening examination. You're like a lawyer, you're building a case, and all you're doing is you're looking at the posture, you're looking at the legs, the arms, the head and neck, the chest, the abdomen, and you're trying to decide, is there enough evidence to warrant a systemic approach to treatment? That's all.
嗯
That evaluation does not diagnose.
嗯
It tells you one thing, right? It's a systemic or specific. That's it. I have other evaluations. I have a systemic evaluation. I have a specific evaluation. I have other detailed evaluations. But yes, it is enough information to do what we want to do, just like in those two examples I showed you.
OK，老师回答是说，基本上老师的这个他的那个 approach 的方式，还是要先搞清楚他到底是这个 systematic 的问题，还是一些全身的这个 pathway 的问题，或者是这个 local 的问题，哈，specific 的问题，这是重点中的重点。那至于说，哎，那个脊椎的 segment 跟脊髓的这个 segment 是不是 correlated？他老师有更 detail 的一个 local 的一些 assessment 的方法哦。那这个重点就是还是要先就像法官在断案一样哈、就是要有逻辑性，先从这个全身性的去看啊，然后再来说限缩到这个局部啊，大概这个观念老师再次强调。那 OK，the another question is about the reliability of the TBSE because it really relies on the manual sensation or palpation skills of the
Mhm,
practitioner.
mhm.
And is there any objective parameters about the examination, or everything is subjective?
Well, number one, it's subjective from the patient because they're going to tell you what their life has been like. Have they been in a car accident? Have they had surgery? Have they had falls? Do they play sports? You can actually, just from a history, tell if somebody is systemic or not, number one. And number two, it is all, I would say it's objective because I've done this, like I've had over 30,000 patients. So I'm doing this thousands and thousands of times. You know, with practice, you're going to see this again and again. And also, how do you know something was accurate? You're going to evaluate, you're going to make a decision, right? And then you're going to treat
Mm,
and you're going to reevaluate. The reevaluation is going to see if you were successful.
yeah.
Okay. That's the most important thing. It's going to show you that you were successful. And if it wasn't, then you need to go back and reevaluate. When you look at medicine, you know, manual therapy, it's an art. It's not a science.
Mm,
We evaluate,
mm,
we make our best choice possible of treatment, and then we reevaluate. That's our model. Were we successful? Did we make the right decision?
mm.
Okay. And that's why we're teaching you to do that. But the evaluations will show you, you know, and what's the other key thing? Is the patient happy? The patient
Mm,
has
mm,
goals.
mm.
Did they go back and play their sport? Did they go back and play their instrument? Did they go back to
Yeah.
work? I mean, that's what
Yeah.
you're trying to do. That's the end result. I mean,
Mhm,
this is solution-based medicine. You're trying to
mm,
solve
mm.
something for your patient. They want something from you, right? And if you don't give them what they want, they're going to leave.
Yeah, yeah,
So the proof is in the pudding.
yeah, exactly. That makes sense. 好，老师的回答是这样哈，就是基本上呢，老师也就是再次强调评估的重要啊。老师会先做评估，然后治疗，治疗后呢又要再 re-evaluate 啊，这个很重要，就是再看看说，哎，经过你的治疗之后，病人的这些 dysfunctions 有没有改善。这是一个 learning process 啊，这个是很好很棒的一个学习过程，才知道说，哎，我的 palpation skills 有没有进步啊？这样子哈。那当然不要忘记了，我们不是在治疗 range of motion 或者是治疗这个 hypermobility，我们是在治疗 a person，所以就是 holistic approach，就是如果病人他后来他的一些 disability 后来改善了，他觉得他原来没办法做的事情，现在可以做，他很 happy。我觉得那是最后的 goal 哈。那至于那些比较一些像这个活动度啊那些，那这些是次要的，最重要是病人他觉得他的这个生活的这个能力大幅的改善啊，这个是重点中的重点。OK，Thank you。
And remember, if they have I have some, students as they're learning, they go, I don't know if I trust myself. Then do a systemic approach with every patient that comes in,
嗯嗯
and then see how they're doing, and then
嗯
start to work locally. So you can do that. And if you had to choose, maybe do the lymphatic one the first time and then orthopedic the second time. So you
嗯
can you can just try that out and see, are they feeling better?
嗯
Remember, the systemic approach works on the pathway.
嗯
And a lot of times by the time you get to the area that they're complaining of, it's better. Just like with that army guy. So it is
yeah.
beneficial to do that approach with most of your patients.
OK, cool。所以刚刚讲到这是一个 learning process，那老师也提供一个学习的技巧，就是说，哎，你学完课程之后啊，回去在治疗病人的时候，你可以尝试着先，哎，每个病人都先从 systematic 开始做，然后呢，你可以挑，哎，今天我就先做淋巴，那下次我先再做这个筋骨的部分。那么可以慢慢你就知道，可以就是借由这个经验啊，去完成你的学习曲线啊，这是一个很棒的一个学习过程啊。OK，the next question，
Mhm.
治疗一次后可以得到多大的效果，或治疗几次后可以完全解决？OK，the question was，how much he fed after one treatment session, and how many sessions that can totally fix the patient's problem.
That's a difficult question
Yeah,
because it all depends on the patient, doesn't it?
yeah.
It depends on, number one, the age of the patient. Okay.
Mm,
Number two, it depends on um, how much of a history they have in their body, like car accident. Like a lady I just saw last week, 10 car accidents she had.
mm, mm.
And she's had surgery to her back. She's a stressful person. She's from New York, you know. She's a mess. I mean, she's a mess.
Yeah.
So she's not gonna, but she's doing a lot better. But it's how much they buy into it. What's their vitality like as well? So there's a lot of parameters, right?
Mm, mm,
Now, you when you do this systemic approach, usually I would say in the first, I would say 3 to 5 visits, they're
mm,
better, right? They're
mm,
better,
mm.
right? But
That's
why
cool.
would you ever why would you ever discharge your patients? My patients are my patients for life. The
Mm,
beautiful thing about this work is patients come in once a month just for a tune-up. Do you remember John Wernham, the guy that taught me? He was 99 years old. You have to ask yourself a question. Why was he able to practice into his 100th year treating 8 patients a day? It's because
mm,
he got treated.
mm,
If you got your legs, your arms, your head and neck, your thorax and abdomen treated, if you got all your transverse diaphragms opened, if you got your autonomic nervous system balanced, think about all the stress we're under.
mm,
Don't you think that would help your body?
mm, mm. OK, thank you. 老
Mhm.
师的回答是这样哈，就是说，哎，这个疗效哈有很多的这个因素哈，有很多的 parameters 要考虑。第一个像是年龄啊，年龄如果老人家通常这个愈合当然是比较慢啊，年轻人效果当然会比较快啊。那再来就是他过去的病史是不是曾经有严重的受伤啊，或者是大手术啊？如果有的话，当然会愈合的慢一点。那另外，他是不是有这个情绪压力？哈，就比如说你住在纽约这样的一个城市，就是生活上就是混乱一片哈。那另外也就是说，病人本身的 vitality 啊，就是他的这个本身愈合的这个动能够不够了哈。那一般来讲，如果是老师做这个 systematic approach，也就是全身的这个治疗方式的话，大概平均3到5次，病人就觉得有改善了哈。那不过呢，你是不是就叫病人说，哎，好了，你不要来了？老师不认为是这样哈，就像是觉得老师有很多病人他都是 lifelong 的让老师来保养的，那我自己认为就像修车子一样，这是我自己家的，就是说车子修好了。 对不对？我是不是以后都不再需要进厂保养了？没有啊，你还是要保养，因为总是会 wear and tear 的哈，所以还是要继续的去 maintain。比如说老师刚刚讲一个99岁的医生，他每天还要照顾8个病人，那为什么？因为他自己也是接受治疗，才会有这么强壮的身体。好，到了99岁还可以看诊啊，一天还可以治疗8个病人。OK，这样有回答您的问题吗？好，next question。嗯，抱歉啊，遮掉。为什么说烧烫伤、截肢或重入？Okay. The question was about TBSE again.
Mhm.
Um, when we apply the TBSE on clients with burn, amputation, or surgical reconstruction after surgery, is there any special consideration when we do the TBSE for those patients?
Well, if it's a burn patient, how much of their body is burnt? They're not going to want you moving their body around.
Yeah.
If it's a burn on a leg, you know, have to ask yourself a question: how does a burn heal? All right.
Mm,
I had one patient. It's not a burn, but it was an open wound, and it was in the bottom of her foot. And
mm,
this physical therapist would do laser treatment, and they would do debridement. They would clean out the bottom of the wound, but it wasn't closing.
mm,
So she was in my class and she says, "Do you mind looking at this patient?" I said, "Sure." I said, "I don't treat wounds, but I'll treat it with what I know." So when I evaluated, it was on her right leg. The right leg was heavier, less range of motion. All the transverse diaphragms were restricted. Autonomic nervous system was affected. So we treated it. I didn't treat the wound. I treated the diaphragms, autonomic nervous
mm,
system, lines of tension.
mm, mm.
And the wound didn't close right away, but the report back to me was the patient started to respond better to treatment because you have created this pathway.
Mm.
Remember, you're treating an intelligent body. That
Yeah.
body knows how to heal itself. You can translate that, and then I'll talk about amputees.
OK，首先针对这个烧烫伤的个案的话，老师说，那你要看这个烧烫伤的面积大不大啊？哦，那老师有个个案，就是他就是脚底它是有个开放性伤口了，那也做过镭射啊，还有一些治疗，但是伤口还是没有闭合的很好，它还是 open wound 的，它还是开的。那老师认为还是可以，人家问说，哎，那这样的个案可以治疗吗？老师说没问题啊，还是可以的。好，可以做一些评估，没有影响，因为老师在这个治疗，因为老师不会光处理 local 的问题嘛，因为他也是全身性的都会看啊。那老师接下来讲这个截肢的个案，Yes please for
Yeah.
amputation。
So, I treat several patients with amputees, and I know one guy, he just uses crutches and he plays golf on one foot. And I work on him. I balance his body out, but he's going to have to come back every month because he doesn't, everything is loaded on that one side. He develops all these imbalances. So I treat them the same as anyone else. And I think it can help with that phantom limb pain as well. If they have a prosthetic device, again, that's going to be better distributed throughout the body. You always want to release these lines of tension. With surgical patients, I think they said surgical. If someone had recent surgery, again, I don't want to move stuff around in that acute phase, but think about it logically. It'd be nice to open up the transverse diaphragms. It would be nice to balance the autonomic nervous system. It'd be nice to free upstream so that the body physiologically is doing properly. Because remember, that you're treating an intelligent body. That body heals itself. The role of manual therapy is just to create a better environment for that.
OK，好，那针对截肢的个案的话呢，老师有就是说有个个案他很有趣，就是即使截肢了，他还在 打高尔夫球，但是他会定期回到老师诊所保养。为什么？因为截肢了之后，他身体重心都会一直偏一边哈，那就会产生一些身体的歪斜哈。那么，所以他定期把它归位回去是很重要的，甚至有一些有患肢痛的个案呢，也是有类似的状况。那至于那个大手术之后呢，老师在急性期是不会处理的。好，那等到比较稳定之后呢，那老师认为这些接受手术的个案呢，有一些治疗是非常有帮助的，像是开这个 transverse diaphragm 把它打开，啊，就是横向的横膈。那还有像那个自主神经系统 autonomic system 啊，也是会很有帮助。也就是说，人啊就是一个智慧体啊。我们做这个 menu 的话，它的目的就只是要让它能够有一个愈合的好环境啊。OK，thank you. 好的，next question.
Mhm.
Okay. When we studied in the medical school or physical therapy school, we learned quite a lot of orthopedic tests like Neer's test, the Hawkins test, or for the shoulder. Uh, Under the structure of DAI, um, when do you think that we will apply these tests on our clients?
Okay, good question. The when a patient comes to you, let's say we gave the example of a knee problem, the first thing I have to decide is, do I treat it locally or systemically? All right. If they're a systemic patient, I'm going to treat them with the techniques I'm going to show you when I come there in the spring, more systemic manual therapy. Once that pathway has been established, their body should start to heal. But if it hasn't, then I'm going to look locally and I'm going to decide through my specific evaluation, what am I dealing with? Am I dealing with fascia? Am I dealing with muscles, with joints? Am I dealing with fluid or energy? And so specific orthopedic tests are part of that. That's more specific. In my first example, I showed you that one guy with the knee problem. When we did the total body screen, he was a specific patient.
Hmm.
So there, again, you always want to find out, well, what am I going to work on? You know, fascia, muscles, joint, fluid, energy. And doing orthopedic tests is just other tests. And that's when you do them, but you wouldn't do them at the beginning. The first thing you want to establish is that, is this specific or systemic? If it's systemic, I don't care about anything local. I want to open up that pathway.
Yeah, thank you.
嗯
好，老师提到就是老师刚开始还是会做那个 screening test，就是 TBSE。那完了之后呢，来确认它是一个全身性的 systematic problems，或者是局部性的这个 specific problems。那您提到的这些 orthopedic tests，那老师会用在这个specific assessment 的时候会用到啊。那他不会在一开始就用到这些 orthopedic test，一开始还是会先确认，先把这个全身性的问题稳定了之后，如果病人的状况没有完全好，那这时候才会考虑呢做这个局部的这个评估和治疗。好，Thank you. OK, next question. 然后同时我加治疗里面会教不同体位的、不同部位的。因为很多地方也能让去。Okay, the question was in the course, uh, are you going to teach us different assessment and treatment methods for different tissues like fascia, circulation, structures, lymphatics? And when it comes to lymphatic, will you teach different treatment in different positions of the client? Yeah, that's it.
Okay. So in this first class that I'm coming to Taiwan with, this is my systemic manual therapy course. And so we are teaching systemic orthopedic and systemic lymphatic.
嗯
So the evaluations we're going to show you and the treatment we're going to show you are all geared to solve those problems. I have other classes, right? I have classes where it's called muscle balancing, and I'd love to come back to, Taiwan in the future, and I can teach muscle balancing, and that teaches you how to evaluate and treat protective muscle spasm. I also have fascial balancing, where we teach you how to evaluate and treat the viscera, the cranial, myofascial, the joints. I have also joint balancing technique, evaluate and treat. I have
嗯
lymphatic classes. Now, all these different classes, the fascia, muscle, joint, lymphatic, we all have 3 levels to them: cranial cervical, upper quadrant, lower quadrant. So we get very specific. So I have specific classes and
嗯
I have systemic classes.
嗯
I am bringing the systemic classes to Taiwan for my first visit.
嗯哼
But if you in the future, if you want, and while I'm there, I have no problem talking about it or showing you a bit
嗯
about
哼
it. But I don't have the time to teach you everything about it. But we'll talk a little bit about it.
OK，是，会的，会的，就是您提到这些不同的这个结构的评估方法啦，或者治疗方式，老师都会巨细靡遗的教学。但是我们在台湾的首首发的2堂课，那这个老师强调这是最基础中的基础啊，就是老师一定会先处理 systematic first 哈，所以这2堂课包括那个 lymphatic 还有这个 orthopedic 的话，老师会强烈建议这2堂课要一起上，不然的话，像有很多个案呢，虽然是看起来像骨科的问题，但是一直治不好，弄了半天，因为它有一些 congestion 的问题，所以但是你不会这个淋巴的手法，你就没办法帮助他们啊。所以，但是日后如果有机会的话，老师非常乐意就是再去教其他的像 muscle 啊、fascia 像是 visceral。cranial, sacral, joint, lymphatic 有关于一些 specific 的 treatments。OK，好，那下个呢？OK，OK. The question was in English. For the combined systematic problems, which barrier is suggested to be solved first, or all the approaches should be applied at the same time?
I don't understand the question.
Okay. If the patient got different categories of systematic problems, like maybe there is a restriction of the fascia or the spasm of the muscles and the lymphatic is obstructions. Which one you will be treat first, or you just put them together during one treatment session?
No, you would decide whether if there was when I heard you, you had both orthopedic and lymphatic. You need to treat the lymphatic first
Okay.
because the orthopedic approach is kind of like from the feet upwards. You're
Mm,
balancing
mm,
layers
mm,
like a skyscraper, a building.
mm, mm, mm,
The lymphatic approach is you need to open up all the transverse diaphragms. You need to balance the autonomic nervous system. You need to treat from the heart outwards because everything flows from a high to a low pressure. So if you
mm,
had swelling in your knee and if
mm.
everything was blocked up here, there's no place for it to go.
Yep.
So you have to clear the pathway first,
Uh,
and then you have to work, kind of backwards like that. So there are different, but if you had both,
uh-huh.
orthopedic and lymphatic, you definitely have to clear the lymphatic first and then do the orthopedic.
哇哦，老师给了一个干货哈，重点中的重点就是比如说老师说，哎，如果你这个有淋巴的问题跟这个筋骨的问题同时发生的话，老师强调哈，要先处理淋巴的问题筋骨的放在后面，这是有顺序性的、有逻辑性的哈。因为如果他有这个 congestion 的问题，有这个肿胀，你如果只有处理骨科的问题的话，它是不会好的哈。所以一定要先处理淋巴，再处理这个 orthopedic。反而淋巴的话是老师做这个全身性治疗的第一步。 啊，先评估有没有淋巴问题，有的话它优先解决。OK OK, that I think that's all in the chat room. 有没有其他？Do you want to ask other questions? You please raise your hands. 如果是要有口头提问的话，可以举手。嗯，没有哦。大家不要客气哦，机会难得哦。好，那我们如果没有其他的问题的话，那因为我们的时间也差不多了哈，那我们在这边就做一个总结。好，OK, I think that's all, and I'd like to share my screen to say
Yep.
something.
Sure.
OK,
Yep.
好。好，那感谢大家今天的参与哈。所以我个人觉得老师的这个体系有3个很棒的地方哈。第一个，他有教我们评估了哈。我们之前不管是学 muscle energy、strength counter strength 什么，都是强调治疗。评估的话是针对那个技术的评估，但是没有一个整体的一个筛检的评估。所以到时候我学了一大堆技术，但是我不晓得要出哪一招。但是那透过老师在上课，未来上课会教我们的那个 total body 的 screening examination 的话，我们就可以知道我们病人的这个治疗的顺序跟次第啊，这个在让我们在疗效上一定是会提升很多。第二个就是老师教的内容是很全面性的，他不会只教 joint，也不会只教 fascia，而是一个很全面性的哈，包括因为淋巴的部分，事实上我们以前常常会忽略掉哈。那我个人也是觉得哇，这个内容，老师的这个想法真的是很棒，所以它是一个非常那个 comprehensive and holistic approach。那第3个特色就是非常逻辑啊，非常逻辑。所以老师说为什么那个要先做，那个要后做，他都会把这个逻辑告诉你啊。所以这样子我们在治疗的时候就心中不会慌，不会乱啊，就不晓得怎么办啊，试试那个没效，没效再试试另外一个哈，这样子病人会对你的信心就会越来越不够了哈。所以我觉得老师的这个体系有这3个特色。好，那我们这一次来台湾首场的2堂课哈，就是第一个，其实淋巴是要先学的哈，淋巴会顺序是比这个筋骨的部分呢是更重要。好，那一定要两者同时发生，一定要先处理淋巴。你解这个筋骨的话，基本上效果不是那么明显。那这边再次提醒我们早鸟优惠哈，就是 early bird discount 是明天哦哈，就是说今天听完之后觉得说不错，那我们明天报名的话还是会享有这个早鸟优惠。那另外老师特别强调哈，就是这2堂课一共6天会一起，强烈建议一起上，这是一个入门课，就是整个系统里面最重要的2个入门课，也是你在治疗上首先会使用的治疗方法啊，所以一定要学起来哈，不然你只学一个就觉得另外一半就没有了哈。那为了要鼓励大家2堂课一起参与哈，所以如果我们2堂课一起报名的话那我们会在课堂中呢，那个工作人员会退款2000元当做一个优惠啊，希望鼓励大家2堂课一起参与啊。那之后如果我经过今天的课程，我对老师的内容是非常有信心，所以如果大家觉得老师的内容不错，老师就有这个机会继续来台湾，把他这个完整的体系带给我们。好，那 OK，Thank you, Carrie. Thank you. Share your precious time with us, and we really learned a lot from your lecture. And thank you again. Thank you.
Yeah, I really look forward to coming to Taiwan, and I think you're going to really like this class because it's going
Mhm.
to give you another way of looking at your patients, and
Exactly.
and everything that you do already can be blended in very easily with this.
Yes. Yeah.
All right. Well, thank you very much,
Thank you very much. Thank you.
and hope to
好，
see you
谢谢。
guys in the spring.
And see you in April.
Yes. All
好，那
right.
我们4月见。好，那谢谢大家，谢谢大家。好，那我们今天的活动就到这边结束，祝大家有一个开心幸福的夜晚啊，大家每个人都睡得很好。好，谢谢大家，那我们这边活动就到这边结束，好，拜拜。
Bye bye.